I've always wanted to be a nurse.
I always knew I wanted to help people.
Because I wanted to make a difference.
I chose nursing because I love people.
My mom said when I got my first nurse's kit that from that point on, I've always said I wanted to be a nurse.
I wanted to make a difference.
Even as a young girl, I always found myself drawn to people that were struggling in some way.
I've always believed that any talents and gifts that you're given in life should really be used to help other people out in some way, shape, or form.
I graduated from high school, didn't really have a plan.
Never wanted to do anything else.
So for us, going into a medical field was something that we knew we could make the difference in the lives of our patients.
So when I got into nursing school, I realized it's just not about the patient, it's about their families too. And you make a difference in many worlds, no matter who you touch.
And I was able to, in high school, you got to go to nursing school, so I continued on from there.
And as a nurse, I find great comfort in knowing that I can comfort them, that I can make that day a little bit better and a little bit easier and make a difference for them in that day to help them through that most stressful, difficult time. And that's what nursing is to me, is compassion and caring and making a difference in others' lives when they most need it.
Just being a source of, calmness for them, maybe a source of happy during a sad day, things like that. I love people.
I was kind of choosing between nursing and art. Nursing felt very natural for me, but I also love the artistic, creative side. And my father was a guidance counselor and said, honey, you're going to starve to death as an artist.
To have the privilege to be a part of people's lives in that way, and to come in to be able to make a difference and to be able to help them out and through those challenges, and also celebrate those victories, it's a wonderful place for me to be.
And I was a tech working on the floor, and after a year or two, I decided that I was at least as smart as any of the nurses that I worked for, and that if they got through nursing school, I surely could do it.
I've had many memorable moments. The one that moves me the most was just in the last year, and it was mother brought her blue unresponsive baby into triage. And I began to resuscitate this baby and carried it back to the treatment room and stayed with it till I could hear it cry. That's unforgettable. I've been able to teach many nurses how to deal with death and dying. And for that, I'm grateful because they've helped many people. And I feel it's my honor to have helped vicariously through me, helped many nurses to learn and grow over the course of my long career.
I think that as nurses, we could write books on memorable moments. However, my most memorable moment of my career was the birth of one of my children who has complex medical needs. It started as a birth. He was transferred from our hospital to Albany Medical Center. His stay in the PICU, his stay in a NICU, multiple stays on a medical floor, multiple ER visits, OR visits. It allowed me to see the view of the patient, the view of the parent. I was no longer that nurse that was just the nurse that could take care of my patient. I was the nurse that was able to allow emotions to support my patients. I could be sensitive to their needs, understanding what they were going through. Fast forwarding to 3 years ago when I took a position at an incredible practice, a pediatric practice, Capital Care Pediatrics in Clifton Park. The wonderful practitioners allowed me to be the nurse I am today, allowed me to support, and Christopher allowed me to support families that I was not able to do in my younger career.
Yes, I have many memorable moments. Anytime that you touch a patient's life or you touch a family's life is memorable to me. One time I had taken care of a young adolescent, and he didn't end up surviving a car crash he was in. And then I realized, as sad as that was, maybe my purpose was to be there for his mom. And you know, they had gone through a troubled time, and for this mom to have to go through that and to lose someone, you know, so close to her, I think I was put there to help her too. So a lot of times it's not about the patient, it's about the fact that that patient is someone's son, someone's daughter, someone's husband or wife, that it's really about a whole family. It's just not about a patient. So there's many reasons to our job. It's just not for the patients, it's for many people.
It would have to be one of many. And I guess I would need to start with a little bit of background. I'm a nurse educator in a small associate degree nursing program, and because it's small, we really get to know our students quite well. And our students aren't the traditional student that you think of that comes out of high school and goes off to live in a dorm where, other than schoolwork, their biggest concern is what to do on the weekend. And to pick one moment is hard, but this particular student was doing very well. And in her last year with us, her grades, they slipped a little. She was still doing well, but her grades were slipping a little. But most notable, she was falling asleep in class, and she was missing classes. As it turned out, her boyfriend was doing everything he could to sabotage her dream. He did not want her to be successful and graduate and become a nurse, because he knew that once she had some independence, he would lose his control over her. So as I mentioned, we're a small school, we know our students, and we worked with her, and I think a very proud, memorable moment for me was watching her, against all odds, dressed in her whites with her nursing cap, walking across the graduation stage, seeing her accept her diploma and getting her nursing pin, and the smile on her face will stay with me forever.
I do have a big accomplishment with, I feel that taking care of children and children that are afflicted with diabetes, and I feel like just getting their families the confidence and my confidence, and you know, everything's going to be okay, and letting the mom, you know, frequently I talk to their families, and our whole school kind of works as a family when we do get our diabetics in there, and anybody with any disease. But definitely my diabetics are my challenge.
I've been a nurse for over 30 years, so I'm blessed with a number of memorable moments. But the one item that really comes to mind when you ask me this question is my career in the cardiac cath lab at Glens Falls Hospital. I was honored to be part of the team that brought on primary angioplasty in the organization. And primary angioplasty is when you have a patient with a heart attack coming in and we need to clear the blockage. Prior to that, these patients came in and they were so sick because what we gave them is drugs to slowly dissolve the clot. And they were very sick. They were in the hospital for 5 to 7 days. They stayed in bed. They had no appetite. They felt terrible. Well, with primary angioplasty, once the patient's on the table, because we physically go in and restore blood flow through a catheter or a stent, within 30 to 60 minutes, they feel great. And I remember this one gentleman in particular that I had to convince him that he had just had a heart attack. He felt so good. He said, "I'm going to go home, right?" I'm like, "No, you still had a heart attack. You need to stay with us." So I think that was my moment in nursing that I realized that as nurses, we need to embrace technology. We need to embrace research and not be afraid of it, because we actually have the ability, the honor to facilitate programs like that, to teach our programs about like that, and to really help them have a better, not only quantity of life, but quality of life. Because, you know, to see the difference in care for these types of patients from in the hospital for 5 to 7 days to be going home in 3 days and, you know, really feeling good was so amazing to me. And that's where my passion is in cardiology and making a difference in the outcomes for patients as well as improving their quality of life.
I had a patient, a pediatric patient, a young girl, 10 years old, over the summer. She came to us actually later in the summer and was here with us for a few months. Over her summer break, she got bucked off a horse. So she came to us in pretty bad shape. But I'm sharing that part because I got really close to her family when I was there. And she went from being to the point where she couldn't do anything, she couldn't communicate, eating was not, eating was through a tube, things like that, just she was at her lowest. And being there with her, watching those little miracles of she started eating, she started talking, and now her mom came up to the unit the other day and showed me a video of her walking, virtually unassisted, with just a gait belt on, and the therapist was just walking beside her without even touching the belt. And I was like, whoa, she's walking! And so it was just great to see that, because 3 months in the hospital, and it hasn't even been a year since her accident, and she's doing great, and that was a little emotional part for me. So yes, that was one of my best memories.
I have many. It's hard to pick just one because I've just witnessed so many people walk with so much courage because my path really became caring for terminally ill people. But it started a long time ago. As a nurse, I was caring for a young girl who had leukemia, and she was only 12 years old, and she was really struggling, and they were treating her very aggressively, and of course her parents, very difficult to let go. And one evening she took my hand and she said, "Karen, please help me to help my parents to say goodbye, and help my doctor to help let go." And I thought, how do I do that? And she was so remarkable, and I just remember her so well and her courage to do that. And so we did. I spoke to them. We came to kind of a peaceful decision together, and we did not have her go into a hospital bed. We found a pull-out bed, more like a couch. And I sat Indian style at the top of her head because she was bleeding through her nose and her mouth. And I had a brown towel, so I remember, so the blood was not so obvious to her parents. And her mom and dad laid on both sides of her, and I at the top of her head, kind of making her comfortable and letting her find that peace, and as difficult as it was to set her free. And I think for me, that was my whole beginning towards ALS, that there is no cure and there's really no effective treatment even today after 20 years of my work doing this. But we needed to find a way to help people with ALS to live, while they're dying, to continue to give them hope, and when they're ready, to help them know how to let go and say goodbye. And to me, that's really what healing is and what nursing is, in whatever way healing manifests itself, through medication, through treatment, through surgery. But healing to me is also about listening to someone and where they are, and when they're ready, to help them let go.
I had a gentleman that I was doing his blood pressure. He wasn't in the hospital. He was going to have some workup done in a week or two with a cardiologist. And he said he didn't feel good that day, so I'm in an outpatient program, and I took his blood pressure, and it wasn't really bad, but I ended up talking to one of the doctors, and we decided to send him to the hospital. He ended up spending 2 weeks in the hospital, had cardiac surgery, lost a ton of weight because he was so full of fluid. And then he came back to me about 3-4 weeks after that and was so very thankful that I had sent him, because the doctors had said that he would never survive another couple days.
But it was an individual that came out of surgery, and there was an intervention that was going on, and they had a systemic reaction to that intervention. And in our hospital, we called together a team of individuals, the providers, to come bedside immediately and to really work with that person to stabilize them, to address the issue, and to get them through that as quickly as possible. in the midst of everybody talking in the room, all the interventions being done, medications being administered, IV sites being put in, just had the opportunity to look at the patient, having worked with this person, understood that they needed a little bit of TLC in the process. And so just leaned over to them and said, what could I do for you right now? And this person said, I just need somebody next to me just to hold my hand and to be here with me through this. And gave up my responsibilities and talked to some people who came in and took on my roles to address the medical part of that and really concentrate on the care of that person and help them out in getting through it and knowing that there was somebody there for them to really address them, their needs, and also just to be with them. And that was really important for them. So that was a very memorable moment.